next up, we've got Sarah Stevens, who's a campaigner and patient advocate, is going to talk about trying to access safe healthcare as a patient. So welcome, Sarah.
Thank you.
And I'll hand over to you. I'll just before you've got about a minute to go, I'll give you I'll just tell you when you've a minute to go. Thanks.
Okay, thank you. I do ramble, so I'll need that.
All right.
So I was diagnosed with aggressive breast cancer in October 2020, but it was early stage, thank God. It was stage 2. So a few weeks later, I started what ended up being 18 months of cancer treatment. So first up, I had chemotherapy, which started literally just as the second lockdown began, and I became clinically extremely vulnerable practically overnight. I was told that in an email from NHS England, actually. And then in December, NHS England's emailed me again to say that I didn't actually have to shield. And then 3 weeks later, Matt Hancock sent an email from the Department of Health and Social Care telling me that I had to shield, and not only that, but I had to stay 2 meters apart from the people that I lived with. So obviously this very confused and very confusing messaging had the effect that I really did start to distrust everything I was being told. Now, I was terrified by cancer, obviously, but I did feel that the NHS professionals that were caring for me did have that under control as much as they could. However, and this is the really difficult bit, I was equally terrified by COVID. And I began to realise that those very same NHS professionals who were caring for me with cancer didn't have COVID under control at all. And they didn't even seem to have the right information at their disposal. And I didn't have any faith in the IPC measures in my cancer unit. So, you know, picture the scene. My life was in their hands. That fear of going to chemo for up to 5 hours every 3 weeks, and all the numerous scans, bloods, surgeries, radiotherapy, you know, I felt it so keenly. My husband and I are both shielding. We no longer go to work. We don't even leave our house. And my biggest risk is hospital. And I felt that really keenly one winter morning in early 2021. My husband, he drove me to chemotherapy, and we passed what must have been 20 ambulances queuing up to drop patients off at A&E, and it struck me right in that moment that if I get COVID, I'm not sure they're even going to give me the care I need. There's too many of us needing care. And that was a really terrifying world in which to suddenly be clinically extremely vulnerable. And I think when you feel that amount of fear, you just freeze. That's what you do as a mammal. You feel powerless to do anything about it. And that's what I did for months. I froze. And I guess that's where a lot of people stay, especially when they're really poorly. But for me, later that summer, Freedom Day, and the extra imprisonment that meant for people like me just made me boil over with anger. And I was beginning a month of radiotherapy. My husband was living in our neighbour's caravan because as a self-employed builder, he had to go back to work after 10 months of shielding with me. And I felt this familiar surge of fear, but there was this new intense anger. And I felt I was presented with 2 choices, you know, fight or flight. And flight just wasn't an option because I needed this life-saving treatment. I needed healthcare workers. My life was in their hands, and I was angry, and I knew I needed to fight in that moment. And I felt I couldn't show my anger to the nurses who were doing so much care for me, nor my oncologist or my surgeon. I couldn't be angry at other patients. I couldn't go down the pub with my mates, you know, and have a good old rant. So I had one outlet, and that was social media. And so that's when the change began for me, because I was in the chemotherapy room one morning and no patients were masked except me. And all of the windows that I opened were being shut one after another. And I posted a frustrated rant on Twitter, and I tagged Trisha Greenhalgh, whose followers picked it up. And within a couple of hours, it had been shared far and wide. And then I tagged the CEO of the NHS Trust. And later that day, I just left the chemotherapy unit, and I was in the car on the way home when I got a DM from him. And he said he'd just been to see me in the chemotherapy unit, but that I'd gone and he'd like to discuss my concerns. I think I said something like, yes, I got the hell out of Dodge as soon as I could. So he wanted to discuss my concerns, and my concerns were many, but roughly divided into 4 areas: lack of ventilation and air filters, masking, which was at best very patchy, lack of testing of chemotherapy outpatients, and an outdated list of symptoms that they told staff and patients to look out for. Those were the 4 main things. So this was November 2021. We were just heading into another winter. And that image of the queue of ambulances was still in my head, you know. The CEO and I exchanged a few emails after that, and he referred me on to the IPC director and chief nurse. And then I had some meetings with the IPC team and Macmillan. And eventually I achieved 1/4 of what I wanted. And the result of that was that they installed HEPA, mobile HEPA units into the chemo rooms in spring 2022, just before I finished my treatment. So I think I just want to sum up by saying, looking back and now knowing what I know about the appalling IPC guidance being given to the NHS then and now, I just want to thank that CEO for going against the grain and for being one CEO listening to one patient and starting a conversation, because I think that's the point. We all just need to start these conversations. And if you can't do it yourself, we need to join together and we need to find groups who can speak for us, and it will help you find those words. And that's why I find clinically vulnerable families who I'm a member of, it's a really powerful force for me. And I'm so, so glad I found them.